If you have pelvic pain, really any form of chronic pain or pelvic floor dysfunction that has contributed to prolapse or bladder leakage or any other form of stuff down there, this video is for you. I know that these conditions can feel frustrating, isolating, and even embarrassing or shameful. I know they feel uncomfortable to talk about. I know you may feel betrayed by your body or maybe by your healthcare providers who you wish would have diagnosed you sooner, or you wish they hadn't brushed you off when you suspected something was up. Or maybe you just wish they'd been able to give you some answers. My friends, please know I have worked with you, I've heard from you, and some of these issues I've even experienced myself. Today, I'd like to share real stories from real people who are dealing with some of these conditions. This is not intended to complain. It isn't to wallow in misery. Rather, it's to shed some light on these under-discussed conditions and to really bring some awareness to pelvic health. Here's the thing. We all know that shadows disappear when you shine light on them. They don't seem so scary that way. They're easier to deal with. And so my intention is that by sharing these stories, you'll gain hope if you're dealing with these issues too. You'll realize that you're not alone, and in most of these stories, you'll see that there is hope. There are options for treatment and healing, and there are ways to work through it. Although the following stories all happen to be from women, please know that men deal with pelvic floor dysfunction and chronic pelvic pain issues as well. So really, male or female, the main takeaway is compassion. Compassion for others because we're all dealing with something. And if you're dealing with any of these particular issues that I'm about to share, compassion for yourself. Let's go ahead and get started with our first story. It starts out addressed to me. It says, Brianne, I just came across your 2017 pelvic health video and want to tell you that this is exactly what I have been searching for and what I need in my life right now. I was diagnosed with a mild prolapse 2 months ago, 13 months postpartum, after a very traumatic childbirth, but my initial pelvic floor problems began so many years ago. It turns out that I have an extremely tight pelvic floor, like you speak about, and I've been clenching those muscles unknowingly for almost 30 years, from the time that I was sexually abused as a child. I have done some research into child sexual abuse because of what happened to me and because I want to help stop it from happening to others. And I've found that statistics show 1 in 3 girls will be sexually abused in some way by the age of 18, and 1 in 5 boys. These numbers are staggering. So I'm sure there are many others with a similar background to mine that hold tension in their pelvic floor. As a child and teenager, I would kegel unknowingly when under extreme stress, and as an adult, my pelvic floor was constantly tensed. Tense was normal for me. My labor and delivery was horrible, lasting 38 hours, with over 2 hours of pushing, resulting in a forceps delivery and 3rd-degree medial-lateral episiotomy. Turns out my baby was posterior and big at 9 pounds, 5 ounces. Also, because of my unknown, extremely tense pelvic floor muscles, I was in no shape to give birth vaginally. After giving birth, I had pain near my episiotomy that did not go away. At my 8 weeks postpartum visit, I explained this to my OBGYN, who checked me and said I was healing fine. I asked her if I should seek pelvic floor physical therapy, as my doula as well as my health nurse suggested that I should because of the traumatic delivery. But my OBGYN said to me almost quizzically, "You don't need pelvic floor physiotherapy." Unfortunately, I listened to her, and I ignored the advice of my doula and my health nurse. Time went on, and at 4 months postpartum, I went to my family doctor as I was still in so much pain on the side where my episiotomy was. She said that I had an abscess on my perineum, gave me antibiotics, and hoped it would go away. I ended up going back for 4 more rounds of antibiotics. I was in so much pain with this lump that would swell up, then go away, then swell again. And because the abscess was not going away, she thought it might be a fistula. She got me an appointment with the surgeon, and at 7 months postpartum, they did a vaginal and rectal scope, searching for the fistula. The surgeon did not find one. He said the abscess was superficial and cut it out. After this, I felt almost back to normal. I thought I was healed, but at times I would still feel a little weird twinge in my perineum. Being almost pain-free lasted 5 months. Then, at 12 months postpartum, my perineum suddenly swelled up with a golf ball-sized lump, again on the same side as my episiotomy. I was in so much pain. I had to go to the emergency room to have it lanced. About 2 weeks after this was when I found some lumps inside my vagina. I went back to emergency, not knowing this was prolapse and not an emergency, to find out that I have a mild rectocele. And this is a note from Bree. I'm interrupting the story to just mention that a rectocele is a prolapse of the rectum. So back to the story. I asked the doctor about pelvic floor physical therapy, and he said that it probably would not help. This time I knew not to listen and booked myself an appointment with a pelvic floor physiotherapist as soon as I could get in. I also made an appointment again with my family doctor to get a second opinion on my prolapse. She said that I have a mild cystocele and rectocele, and that my uterus is also low. She had very little sympathy for me, and in her words said, "This prolapse is normal after childbirth, get used to it." I was very upset by this. She did agree, though, that pelvic floor PT would help, but her attitude angered me, rightfully. Thankfully, I then met my now pelvic floor physical therapist, who was a shining light in all this mess. After she heard my history, before even examining me, she knew right away that I would have an extremely tight pelvic floor, contributing to many, many problems. Upon examining me, she confirmed that my pelvic floor was super tight, and also that the muscles on the side of the episiotomy were wasting away. She also explained that the abscess and fistula was likely happening because of that muscle being too tight and not being able to heal. My prolapse was due to the repeated trauma I've had on my poor pelvic floor, as well as the exhaustion from the super tight muscles. Finally, someone who took me seriously, understood me, and was able to figure out the root of the problem. At that appointment, she relaxed the muscle, and this hurt so bad, and I finally became aware of the extreme tension that I had in my pelvic floor. It was after that appointment that I found your pelvic drop video. I was searching for pelvic floor help and how to relax that muscle now that I knew my problems were stemming from that muscle being extremely tight. I was in so much pain from the physical therapy appointment, and that night when I did your video over and over, I really felt like it was a revelation for me, with the muscles relaxing unlike I have ever felt before. I was moved to tears as I became more able to relax and release my body. It was as if I had to release the physical pain and tension that had been pent up for so many years, like my body was holding on to its own emotional pain that I didn't realize. So that brings me to now. I wanted to share my story with you to thank you for the difference you've made in my life and to show that I support what you're doing for pelvic floor health. I really wish I had known about how to care for my pelvic floor earlier. I had no idea that so many things I was doing were contributing to more problems for my already traumatized pelvic floor. I think that pelvic floor health should be taught in a health class when women are teenagers, or at least discussed more by OBGYNs when a woman is pregnant. All I was told was to do my Kegels, which really gives zero information. I will definitely pass on the information I've learned to my daughter in the future, and likely someday your book, so that she can know what I wish I had learned ages ago. And now on to our next story from a viewer, which is about bladder leakage. This viewer writes, I am a 54-year-old female with 2 adult children in their 20s. I've had issues of stress incontinence for 20-some years. I leak when I lift heavy things, sneezing, walking long distances, and any type of aerobic exercise. In the beginning, it wasn't so bad, but now I have to wear a panty liner every day and sometimes have to change it 2 or 3 times a day. It's starting to affect the way I live my life. I want to go on a long, challenging hike, but I can't because there are no bathrooms along the way and nowhere to change my pad. I've tried Kegels and diet changes and drinking more water and get no relief, so I usually quit. Our local medical network had a great incontinence center with physical therapists and biofeedback, but I've always been too embarrassed to call and make an appointment. Last year, I finally got up the nerve to call, and the lady on the other end told me that the center had been closed indefinitely. I was crushed. I found your videos on YouTube and love the way you say it like it is and are focusing on pelvic health. I'm hoping you can share my story and tell other women and men that this is not something we have to live with. I have made an appointment with a urologist for next week, so hopefully he can get me on the right track. This next story is about painful sex. It's a really candid and open story from blogger Jessie Coulter. So here's Jessie's story. She says, about 8 years ago, I knew something was wrong with me and decided to see a gynecologist. I told her about my vaginal issues and the pain and discomfort I was feeling, and so began the many years of trying to figure out what was wrong with me. Some doctors gave me ill advice, some had no idea what to do, and finally one recommended I see a physical therapist. That physical therapist diagnosed me with vulvodynia, and I began physical therapy sessions for the first time. 2 years later, I moved to Austin, Texas, and found a knowledgeable doctor and an amazing physical therapist. I was then diagnosed with vaginismus. I began treatment and learned more about my body than ever before. I used dilators and saw my therapist every few weeks. And this is just a note from from Brianne. Vaginismus is when the muscles around the vagina spasm and become extremely, extremely tense at any type of penetration. Okay, I'm going to go back to Jessie's story here. She says, looking back, I felt very isolated, especially when my married friends would bring up sex and marriage. I felt absolutely terrible that my sex life was so much different from theirs. I wanted my husband and I to be happy, which we were, but it could have been better sexually. I remember crying all the time thinking about how screwed up my body was and that I'd never be able to fix it. Ever since I was a child, I've had chronic yeast infections, and I think the painful treatment of those might have led to the pain I experience now. Thankfully, probiotics really changed my life when it came to combating yeast infections, and these days I only have a couple of them in a year. I shared my story on a blog and a podcast a few years back, and it was extremely freeing. Hundreds of women emailed me that also suffered from pelvic floor pain and had never told anyone. Since then, I'm much more open about the subject, and I'm okay with being vulnerable. Many women suffer in silence, and I want to be an advocate for them. I want them to know that they're not alone, and I want doctors to be educated on this topic. I want women to speak up to their gynecologists and for their gynecologists to be able to help them. And Jessie concludes by saying, there's so much more to my story, but it's hard to get it all down. Again, just another note from me, check the video notes below this video for links to the blog posts that Jessie has written for other publications. So now we're going to move on to a story about pelvic organ prolapse. This person says, I am 62 years young, have 8 kids, 7 were vaginal births, 1 was a C-section, and 1 of the birth events was a vaginal delivery of twins. After the birth of our 5th child, I became aware of what I call a floating bladder and was told by my family doctor that there was no point dealing with it until I was done having kids. Makes sense. I think the hormonal changes of menopause brought on the severity of pelvic organ prolapse symptoms that I was developing for years. I now have, in my urogynecologist's words, a good 3 out of 4 prolapse. During the last few years, I have been advised to do my Kegels. I've purchased a pelvic floor strengthening system, I've tried to be fitted with a pessary, and have basically been unsuccessful in all those efforts. I've finally found a wonderful physical therapist who specializes in pelvic floor therapies. I am being more effectively trained to do Kegels that actually work, and I'm starting to learn some other helpful exercises as well, thanks to you, Dr. Bree. The more research I do regarding surgical options, the more determined I am becoming to focus on better self-care in an effort to avoid the surgical route. I am becoming a passionate advocate of postpartum physical therapy care for all women. The next story is about chronic pain. This is not necessarily pelvic pain, it's general pain, but I still wanted to include it in these stories because it may resonate with so many of you. So here's the story from the reader. She says, why do I exercise? Because it makes me feel good and it helps me to not hurt so much. I didn't exercise for years because I hurt all the time from my rheumatoid arthritis and fibromyalgia. My doctor finally said to me to try some stretching exercises to see how I felt. I decided I didn't have anything to lose, so I started stretching. It felt so good, I continued. Around that time, I found FemFusion and started following Brianne. Currently, I'm doing hip circles, the countertop mini movement breaks, the seated fitness movements at work, and at night I dance around for 10 minutes to get the blood flowing, and then I just do some simple exercises. I have found that if I exercise during the day in 5 to 10 minute increments and stretch my muscles, that it actually helps, and I don't hurt so much. It loosens them up. Through trial and error, I have found out how long I can exercise. If I overdo it, I can't move or walk the next day. So I owe Brianne for my ability to move more and not be in as much pain as I used to. If I hadn't started doing the mini movement breaks, I would still be hurting all the time and having problems walking and using a cane. I'm not pain-free, but I can walk without my cane now, and I move more freely than I did for years. The next story is another story from a viewer about pain due to chronic clenching of the pelvic floor. So here it is. She says, I want to send a personal thank you for posting pelvic floor tips and stretches on YouTube. I had a bad experience with an IUD insertion. I've never had children, and I wasn't dilated for the insertion, which disrupted my pelvic area enough to cause muscle spasms in my pelvic floor. Over the past year, I've tried everything to make the pain go away, particularly during intercourse, from treating possible pelvic inflammatory disease with antibiotics, and even trying to eat healthier thinking it might have been bowel issues. Then my urologist told me I had hypertension in my pelvic floor. I was freaking out. I was in pain, and I was terribly missing the connection of intercourse with my boyfriend. I was very upset and desperate for help, so I turned to every article written and every YouTube video made for insight. From the time of my appointment with the urologist until my first physical therapy appointment this last Friday, I've done your pelvic floor release stretching routine in my living room. Candles lit, lights dimmed, and a comfy blanket on the floor. This has been a series of about 2.5 weeks, and believe it or not, I have finally reached peace and release in my pelvic floor. I'm even able to have intercourse again, not extremely enjoyable yet, but not as excruciating as before. I'm going to continue doing your stretching routine 3 to 5 times per week like you suggested. I felt the need to reach out to you and personally thank you from the bottom of my heart for sharing your knowledge with those of us in need. It's an untouched subject, and it shouldn't be. All my life, I've clenched those muscles almost constantly, not ever realizing it could cause potential harm. And this is Bri again. I'm going to link to the video she's referring to in the video notes below this. Our next story is about postpartum changes. The viewer writes, I am a 40-year-old physically active woman. My beautiful daughter was water birthed naturally 6 years ago. I remember at the time she was about to enter the world feeling that ring of fire and the encouragement of my midwives to push at those final moments. Feeling the unbelievable pain, pressure, burning, aching, searing, amazement, wonder, and awe-striking, beautiful torture that my body was undertaking. When it was over, I was surprised to find out that I had no tearing, only some abrasions. It was more than a year following her birth that I tried to return to vigorous exercise. And it was at that time that I realized my bladder was leaking small amounts when doing plyometric exercises or even just running. I modified, and modified to prevent the leaking. I was alarmed, but figured it was natural and would just go back to normal with practice. I had no idea and no education on the subject while pregnant or afterwards. I really wish our healthcare providers would prepare us for this, allow us to seek physical therapy postpartum for preventative treatment, as I've learned they do in other countries. Over the years, I've noticed changes in my pelvic floor, both positive and negative, but it has never resolved. I tried Kegels so many times and gave up because it seemed to worsen the situation. I think I was doing them incorrectly. No one tells you about the full release. Thank you, Dr. Bri. About a year ago, after researching, I realized I need to work hard at this every day or it will become something that limits me forever. I struggle with consistently doing the pelvic floor exercises. I start to feel stronger and forget about the issue and forget to exercise until the weakness comes back. There are times I feel weaker in the pelvic floor that I believe is due to hormonal changes in my body, and it seems that I have no control over the issue whether I'm exercising or not. This is frustrating. Sometimes sex makes me nervous if I'm feeling weak, and it's hard to let go and just be in the moment. It's critical for us women, and I love having sex with my husband, but I hate feeling trapped mentally by this issue. I'm scared that I won't be normal again, and if I do reach my goal, that age will inevitably reverse all of my hard work. I'm vowing to be consistent, and writing this to you helps me affirm that goal. Okay, I want to finish up with some quick stories that bring up the importance of talking about this stuff. Here's the first one. After having 4 vaginal births, I never once heard my OB talk about prolapse. Honestly, if it weren't for you, Bri, I wouldn't know what it was. After my 3rd child, I started doing FemFusion, diastasis recti, and core strengthening exercises. My 4th delivery and postpartum recovery were by far the easiest. That's so exciting to hear. Okay, the next story is from Megan of renewingallthings.com, a great blog that you should all check out. She says, after my birth, I was not expecting to feel the heaviness and pain around my pelvic area, and I was afraid to have sex. I was also afraid I had prolapse. After resting and doing core and pelvic floor restoration, I'm all better now. Hallelujah. This next story is from a friend of mine, actually, who shared a kind of somewhat comical, very touching, bittersweet story. And here is her story. She says, I was in the pre-op area at the VA hospital waiting for my surgery, and there was an elderly man who was striking up a conversation with me. The old man says, "What's your surgery?" Me, I'm getting my laughter bladder taken care of. Old man, I've never heard of a laughter bladder. What is it? Me, every time I laugh, I pee my pants. The man says, oh, blushing, I have incontinence. And my friend says, this is proof positive that if you're willing to share, chances are you'll find much in common with those around you. She goes on to say, actually, I think I did reach out for a second, but I didn't really follow through with the conversation, much to my detriment. I don't necessarily regret the surgery so much as I regret that I didn't learn more about my pelvic floor prior to the surgery. I had so many complications after. They're resolved now. But if I had known then what I know now, I'm not sure the outcome would have been any different, but I'd have considered the pelvic floor attention well before the surgical option. And that's that, you guys. I just touched on a tiny handful of conditions and concerns that can be associated with pelvic pain and pelvic floor dysfunction, but I want you to understand and realize that these under-discussed problems are way more common than you might think. So if you ever need help with something, speak up. Talk to your healthcare provider, and if he or she doesn't take you seriously, talk to someone else. There is help out there, and you know your body best. So listen if you think your body is telling you that something is off. Check the video notes below this video for a link to a women's health physical therapist locator, and keep an eye on my YouTube channel for more pelvic floor and core focused workouts and information. My aim is really to bring awareness to these issues and to bring pelvic health to the people. Someone's got to talk about it. It might as well be me. For more ways to connect, definitely stop by my website, FemFusionFitness.com, and check out the information I have to offer. I have archived blog posts. I have a link to my book, Lady Bits, which is available on Amazon.com. And I have other ways that we can connect and contact one another so we can really support each other going forward. Thank you so much for listening all the way till the end and just having compassion for the people who shared their stories with me and with you. Please share this video with a friend who you think it might help, or even with a family member who may not have any of these issues but may be able to also help spread awareness about the importance of really recognizing and talking about and sharing about these issues related to the pelvic floor. Thank you again, and we'll catch you next time.